people with disability have had issues accessing healthcare services because of the inability of healthcare providers to offer the services that they require. And this one has come because of quite a number of challenges or barriers that during this session, I believe we are going to be able to know how to handle those barriers. And some of the barriers that we are able to identify include physical barriers, social barriers, economic barriers, and even communication barriers that we've been able to identify today. And I believe through this training that we are having, we are going to be able to address those barriers.
Today, we see this as a great move for the government and the British government coming in partnership to give us an experience or just these learning skills on sign language. I believe from here, especially since all cadres are covered, we are going to be able to serve persons with hearing impairment diligently. And of course, given that also gender-based violence activism and advocacy is coming up, I believe this is the right moment, and we really do appreciate this move. This learning is going to only open opportunities for our hearing impairment persons, but it's also going to better Busia as a county and as a community.
We normally experience challenges whereby, like in Kocholia facility, you only have one nurse who is trained in sign language. And with this training that is there, as the program is going to roll out, whereby we are going to use the AssistAll application, which is going to enable the healthcare worker to attend to this client where they are, even if they are at home, to make sure that all our clients get services as they are supposed to get, despite the impairment they may have.
Piloting the use of AssistAll as a digital tool in access to inclusive healthcare. A sign language interpreter plays a crucial role in the life of a deaf person, aiding in effective communication, service delivery, and service acquisition. The gap that misses in the service acquisition, which is healthcare service, has actually been not the provision of healthcare, but the communication during healthcare provision.
Today we are here at Busia County with healthcare workers from the county, and we are trying to help them with knowledge around disability mainstreaming and advocacy at their places of work. So we are having 3 days training program for healthcare workers within the county on understanding disability, human rights, and inclusion. Generally, today was our day 1, and we've been able to do so much. First, what is disability beyond the physical impairment, but the societal barriers that lead to discrimination and stigmatization. They have been able to learn about the basics of disability, from the techniques, assessing someone who has a disability and how to interact, communicate, and just give the appropriate treatment to a patient who has a disability. We've also been able to understand the models of disability, from the medical model to the social model of disability, and they have been able to know the kind of barriers that are making people with disabilities not thrive, yet we are the people who are creating these barriers, be it societal, legal barriers, economic, you know, all that kind of policy reforms that are also discriminating. And we are looking forward to better engagement moving forward